used to have a traditional offer for people in their last weeks of care, which was very restrictive, and there was almost an assumption around what people wanted. Personal health budgets have allowed us to completely personalise the support that people receive. So when we began trialling this last year, nobody commissioned their support to look like our traditional offer. So we were able to see quite clearly that we didn't necessarily know what was best for people or what people wanted.
Morning, good morning. Welcome to the hospice. Thank you. If you could sign in, and can I ask you to grab a visitor's badge, please? I know you know where you're going.
We are working very closely with St Rocco's, which is a local hospice that supports people from when they have a diagnosis, so much earlier in the process than when they're at the last days and weeks of life. They've received some training from us around what personal health budgets are, how they work, what the processes are, and what we need for a personal health budget. So around health outcomes, indicative budget, those sorts of things. And then they've been taking that and working directly with patients to complete support plans and submit them to us so that we can fund the care that people want. So around perhaps independence, it'll be some family members, some volunteer.
Personal health budgets have just been a real benefit for patients and their carers. In one way, it's allowing those conversations to start about what people do want at end of life. It's introducing services to people. It's allowing people take independence in end of life and make their own choices about what they want.
I woke up Wednesday morning, 5 o'clock, stepped out, put one foot out of bed.
Since I've had a personal health budget, my care has improved. An example was when I wanted to get washed and showered at 11 o'clock. A lot of carers wouldn't come back to do that, but that has to fit in with my breathing pattern, because first thing in the morning I couldn't take it, and the fact that they come back a few hours later when I've got my breath, then I can cope with getting a shower, you know, which the others won't do, you see. It's got to be first thing in the morning or do without, so to speak, you know. I mean, they're very flexible for you, you know, as much as they can be, you know.
For people in their last days and weeks of life, this will be one of their last big decisions, and you only have one opportunity to have a good death, and we're really keen on being able to improve people's experiences around their end of life care, not only for them but also for their families and loved ones who are supporting them through that.
Well, that's what's nice, isn't it? Because you get to know us, don't you? And you get to meet us. We've had some lovely feedback from families, from patients that have been on a personal health budget. And when they talk about the sort of services they've been able to access and how that's really made a benefit to somebody being cared for at home.
It makes me feel secure in everything that I'm needing, you know. I know that they're going to be there for when I want them, what I want them for, you know. It does make me feel secure.
The outcomes have been really positive. For patients, their focus is around reducing anxiety, symptom control, pain management, those really important things that we're really looking to tackle. And some people have been very creative in how they've chosen to commission their support to meet their needs. Overall, as a CCG, it's also been really positive. There's been no additional costs incurred, so commissioners like it, patients like it as well, and we've had an increase in the number of people who have been able to achieve their preferred place of death as well, which is positive for everybody involved.